Hello all, this is Dr. Apara, Director of the SASH Lab at Yale, and I'm here to share with you all highlights from our Summer Youth Research Program. We accepted 23 teens from Paterson, East Orange, West Orange, Newark, Montclair, Teaneck, Somerset, and other cities from New Jersey. Our goal is to train the next generation of substance use and prevention and treatment scientists from New Jersey, and I think we did it. Throughout the program, the teens learned from various SASH Lab members. It was truly an all-hands-on-deck effort. They learned from Miss Christina, Dr. Wirikun, Miss Betty, Miss Kim, Miss Catherine, Miss Funcia, Miss Miriam, Miss Namisha, Miss Shreya, Dr. Rutledge, and others. They learned all about what participatory research is and various public health methods that we use in substance use prevention research. Why don't you hear directly from the teens themselves?
So before starting the SASH Lab program, I had no clue what public health was, but these past 6 weeks have really opened my eyes. Now I know that public health is a science of protecting and improving the health of our communities.
Being a part of the SASH Lab, I was able to learn about substance use and the symptoms that associate, such as mood swings, withdrawals, and financial stability, and how negatively it can impact a person's life by having complete control over it, what they do physically, mentally, or emotionally.
Public health and substance use prevention not only benefits the community, but it benefits the people inside the community. If you are able to get the help that you need and deserve, you'll be able to be your better self, and that's something that we learned from the SASH Lab.
We brought in Dr. Rios and Dr. Ucheyaneni to teach the teens about machine learning and AI, which is a big part of the project, and how it can be used to predict substance use disorders and work on preventing them.
Hey, don't you know that data plus math equals AI? So what we learned is that we can use AI to address substance use among teens and offer innovative and effective solutions.
For example, an innovative idea is creating an educational video that resonates with teens. Additionally, AI can personalize treatment plans by learning from vast data. By harnessing AI's capabilities, we can enhance the prevention, early detection, and personalized care against teens using drugs and substances.
We had the pleasure of having Angelo Pinto and Dr. Jamila Davis deliver their Be the Changemakers curriculum, where they taught the teens all about advocacy and where health disparities come from, and even invited the teens to be a part of the East Orange Swept Fest.
I realized that most teens who use drugs such as nicotine and marijuana often chase an ethereal high. However, this pursuit often leads to bad habits and negative consequences. As a result, I wanted to reclaim the idea of euphoria, making it synonymous to healthy choices and well-being. I had the idea to create a name that would really resonate with our audience. I'm proud to have coined the term HEY, Healthy Euphoria Youth.
Our main goal with HEY is to raise awareness among teens in New Jersey about the issue of substance use.
And with this coalition, we plan to give teenagers a safe space to share their experiences with substance use disorders. We hope they will use the information provided to spread awareness, inform their peers, and come up with proper prevention strategies.
We brought in Dr. Robin Stevens from California, USC, to teach the kids how to create a social media drug use prevention PSA.
Social media is a broad platform that consists of Instagram, Twitter, and many more. With that being said, not only are we given the opportunity to share our experiences, our stories, but also our voices to New Jersey and all over the world.
Social media is vital to our movement. With the help of storytelling and humor, we can spread awareness all over the world on the abuse of substances amongst teenagers.
Using the social media strategies we learned from Dr. Stevens, we were able to create effective and creative commercials that we thought would prevent the use of substances.
Dr. Wirikun, Miss Namisha, and others gave the teens a thorough lesson on research methods.
We learned a lot about qualitative and quantitative research this summer from the SASH Lab members.
What we learned about qualitative research this summer is that it can be either personal interviews or it can be focus groups ranging from anywhere to like 4 to 8 people. And these interviews, they can be on a more personal level and it can feel like a conversation instead of like you testing the person and trying to get them more as like a number or percentage. So I think this is a really valuable way to like gain information and basically just know who you're talking to in the community.
Quantitative data more so focuses on numerical values and statistics, mainly through surveys. And even though it's not as personal, it's still able to capture what the community needs.
And we can't forget about Miss Monique, our parent liaison, who was there with the teens every day and loved on them like her own. We are so proud of the teens and all they accomplished. World, get ready. You are looking at the next generation of substance use, prevention and treatment, and public health scientists.